Welcome everyone to this Facebook Live. I'm Heather Crawford with First Coast News, and I'll be moderating this roundtable discussion. And we are so glad that you're joining us today for what I hope will be a very important, informative discussion on mental health. You know, we have experienced so much over the past 3 months, from the pandemic, the stay-at-home orders, to thousands of our family and friends, maybe even you, losing your job, and now weeks of protests following the death of George Floyd. It's left a lot of us in vulnerable positions. I mean, just a range of emotions we've been feeling, everything from fear to isolation, anger to stress. I'm sure you felt all of that during this time of uncertainty, as I certainly have. And so for those of you who don't know where to go, who to turn to, first and foremost, we want you to know today that help is available. Do not lose hope. And so the Nassau County Emergency Management has brought just an amazing team of local experts together here to share their advice, to answer your questions, and most importantly, to connect you with the resources that are available right now in our community. So we invite you right now to join in on this conversation. You can chat with us on the Facebook Live comments right there in the stream for the next hour or so. You can also post your questions on the Nassau County Emergency Management's social media accounts, Nassau EM on Twitter, or you can send your questions in by calling us at 904-548-0949. One more time, 904-548-0949. And we're also streaming this on the First Coast News Facebook page. And if you go to our website, firstcoastnews.com, we have listed a link to all kinds of resources available in our community where you and your loved ones can turn for help 24 hours a day, 7 days a week. Now, before we start answering your questions, I'd like to take a moment to introduce each of the panelists who are here with us today. And I want to begin with you. Dr. Laureen Pagel is the CEO of Starting Point Behavioral Healthcare. It's a community-based behavioral health treatment agency in Northeast Florida. And so, Laureen, just take a minute to share a little bit about your area of expertise and what you're seeing right now.
Certainly, Heather. And I just want to say thank you for allowing me to be here today. Mm-hmm. This is such an important topic for all of us, not only in Nassau County, but in the country. As you said, I am Laureen Pagel. I'm the CEO for Starting Point Behavioral Healthcare. We are the community safety net provider for mental health and substance use disorders in Nassau County and Northeast Florida. I've been working in this field for 30 years now. I know it's hard to believe for myself too. And I've never seen anything quite like what's been going on in this country now. It's almost a perfect storm. We have seen, most importantly, an increase in relapse due to COVID-19. And again, the anxiety, the fear, the depression, increase in mental health crises, increase in suicides. And on the other side, too, that we've also seen families coming together. We were commenting earlier, we've seen families bike riding together, exercising together, reaching out people you've never spoken to before through Zoom. So there's always the good side and the bad side. But we want to be a resource for anyone in this community. We have a 24-hour, 7-day-week crisis lines that are available, and those numbers are posted out there. So again, my expertise is really working with substance use disorders and mental health crisis, and we'll be talking more about that.
Yeah, and we thank you for all that you're doing in our community to help so many people. There's a big need right now, and so thank you for all that you're doing. Our next panelist who I want to introduce is Katrina Robinson-Wheeler, and you are Community Liaison and Mental Health First Aid Instructor and Educator at Starting Point Behavioral Healthcare. And so, Katrina, tell us a little bit about what you specialize in.
So I am employed with Starting Point Behavioral Healthcare. I've been with the agency for 19 years. It'll be 20 years actually in September. And I've worked in many different capacities while at the agency. I'm a therapist. That's who I am to my heart. And I started out working with women in substance use disorders and trauma. And I noticed that a lot of the women, I would say anecdotally, probably about 95% of the women that I served had experienced trauma, childhood sexual abuse or continued adult domestic violence. And it just sparked an interest in me. So I started doing a lot of studying and training related to trauma aspects as it relates to not just women with substance use disorders, but everyone. So that's one of my specialty areas. It's kind of a passion of mine. I've also I am the community liaison and educator. So it's my passion also to educate individuals about mental health and substance use disorders. And so we can reduce the stigma and allow people to reach out to get more help. And I'm also on the MRT team with Starting Point, the mobile response team. And actually, I've done emergency services with the agency for about 15 years, but just recently, the last year, the face-to-face, and due to COVID, some of it is virtual as well. So those are my expertise in this field. I've been in the field for about 23 years and just very passionate about it.
Well, we're so honored to have you here with us today. And it's so important, I think, for all of us to take care. Mental health is just important as physical health. And a lot of times we forget about that. But it's important to ask for help if you're out there and struggling. Help is available. All right, our next panelist is Cassie Ott. You are Outreach Director at Micah's Place Domestic Violence Center in Nassau County. And I know right now, domestic violence cases in many situations are on the rise. Tell me a little bit about your organization and what you're seeing.
Thanks, Heather. So I'm Cassie Ott. I'm the Outreach Director at Micah's Place. And part of my job is to go out and educate the community on our cause and what domestic violence can look like. And so right now, amongst everything that's happening, we are seeing an increase in incidents of domestic violence, but even more so the types of domestic violence that are happening and the severity of things that are coming forward. We operate an emergency shelter, and at this time it is full. And we've seen an increase in hotline calls. We also operate a 24/7 hotline where we're able to answer questions in confidentiality. Our services are free. We know right now a lot of people are in financial stress positions, and we want everyone to know that we're out there, we're free, we're here to help you. But specifically in the terms of domestic violence, it's very scary to make that first call and to know that help is out there, that it's confidential and your business is going to stay between us and you, and we're going to believe you is very important. But staying at home can increase tensions in general in non-abusive situations. So thinking of women and men and children who are all stuck at home, that can definitely increase tensions and can escalate things very quickly. So we're seeing a lot of different types of violence escalating more quickly than we usually do. Things like isolation play a heavy role in what we see. Financial stress and financial abuse are very real. And so when the money's not there, stress kind of increases. So at Micah's Place, we really just try to meet the survivor where they're at and give them the help that they need. So my job primarily focuses on community education. So I specialize in violence prevention. I have the pleasure to spend time in some of the Nassau County schools, teach kids and adults on how to be empathetic and how to solve problems nonviolently. And that's kind of the route we want to take to prevent this from happening. And a couple of the other things, I work side by side with Katrina on adverse childhood experiences education, talking about that trauma that a lot of people experience and how to unpack that and move forward so that we can kind of break that down and not continue that path. So we're available 24 hours a day, and we're really thankful to have the opportunity to serve those who need us.
Yeah, well, thank you for being here today. You have a lot of insight that we're going to continue to share with everyone watching right now. And our last panelist, I should say.
Finalist, yeah.
Finalist, you're the finalist. Last panelist is Jim Tippins. You are a board-certified chaplain who works with community hospice and palliative care of Northeast Florida, specializing in loss, suicide survivors, and end-of-life decision-making. And so, Jim, thank you for being here today. Share with us a little bit about your specialty and what you are seeing right now.
I'm honored to be here, for one thing. Glad that we get the opportunity to talk and to address some of these issues, but also with colleagues that I've worked with for 13 years in one form or another doing this. For, 30 years, I was a pastor and a chaplain, working both in a parish and then in hospital settings. But the past 13 years, I worked as a part of Baptist Health System, particularly as the chaplain for Baptist Medical Center Nassau. I retired from there last July, and that was a wonderful opportunity for me to then move into grief counseling. I have a private practice called Changing Tides of Amelia, and it's focused exclusively on grief and loss. And so I'm with people now and working as a hospice chaplain part-time. I told you, Heather, a little while ago, I'm in a very small group of people that I call last responders. Chaplains and funeral directors are the people who come in as most everybody else is leaving the room. And we're there with the residuals of family grieving and asking questions. And then since COVID, we've not had that opportunity. People have had to grieve at a distance, and there's a huge amount of unresolved grief, and people to not knowing what to do because their world has shifted, and those people that were so important to them, those jobs that were so important to them, those parts of their lives have all been lost in this. So we're doing a lot of work. I'm seeing a lot of people trying to find their way through a very difficult time with their grief, and it's a real honor that I get to witness their grief, help them see and find resilience, and to go and continue to live. And so it's a real honor.
Yeah, it's an important job that you have because you're with them in such, trying times right now.
It really is. It's a graceful time. I'm honored when people let me into their story, when we get to see and help them and hear of the loved ones. It is just an incredible privilege. Yeah. So I'm glad to be here to talk about how this grief is impacting us when we're grieving at a distance, and how that comes out in anger, it comes out in frustration, it comes out in depression. And so we'll address some of those.
All right, Jim. Well, it's an honor to have you here with us. So we are getting in a lot of questions, and so I want to get to some of these questions. And the first one says, I'm looking to get some help for my father. He's 75. He lives alone and seems to be suffering from some depression and is an alcoholic. Nothing I do seems to help. He's in denial. I desperately want to get him help, but I don't know where to start. It's taking a toll on my well-being as well. I will not be able to hear or see this live broadcast, so I'm hoping that this program will be viewable beyond this broadcast. And it will. This is going to be on the Nassau Emergency Management's Facebook page. So if you can't join us, you can watch later. But that's a good question. Who would like to answer it? Laureen?
I'll start. First of all, I can say one of the most difficult things is to have somebody accept the help and recognize that they need help. Especially as you get older in life, you kind of get set in your ways and you're not likely to change. And that acceptance is very, very difficult. So I'm sorry that you're going through this with your father. And there's still stigma associated with that too. Again, different generation. People don't want to admit that they have a mental health or substance use problem. We do have a 24/7 hotline number, 904-206-1756 that you can call anytime, and your father can call. So the first thing I'm going to say is you need to get help for yourself. Get into some counseling for yourself and learn how you can manage that so it's not causing you your own stress, anxiety, and depression, because you can't be there for someone else unless you're in a good spot. So that's the first thing I'm going to suggest, is that you get with a counselor, and that's something you can talk about in therapy is the best way for you to handle that for yourself, and then ways to help your father maybe recognize that there's a problem.
And Katrina, when we talk about people struggling right now, I mean, people struggling in so many different ways, touch on just how important it is to take care of our mental health and kind of the best ways that we can all do that.
Well, as Laureen stated, you can't really help anyone else unless you're helping yourself. So there's different things that you can do. First, you need to honor your feelings. You need to identify in yourself that you are feeling stress or depression related to whatever. You need to identify that in yourself. And then you need to kind of think of what brings you pleasure, what makes you happy. It could be a person, place, or thing. Like, for example, I have a dog, Drake, and Drake makes me very happy. And I like having him around because he automatically changes my mood. So think what makes you happy, what you get pleasure from, and then try to do that thing. If it's something related to finances, anything that you can think of, whether it's watching a show, definitely removing yourself from all negative aspects. For example, the news. Don't continue to inundate yourself with negative activities or hearing negative things. And just try to do what makes you happy. If it needs to go to a professional level, as Laureen said, there's all types of resources. We have a resource for emergency services. There's all type of support networks. I know everything is virtual right now, but that even kind of makes it easier than having to go out your door. You can go online and tap into Al-Anon, for example, for that person with that question. That would be a good resource for her, Al-Anon. But just think of things that make you happy. I tend to use mindfulness. I love mindfulness. You can associate a word with a place or a thing or a person. So, for example, My word is mango. When I think of mango, it puts me back in Trinidad, and I immediately feel the breeze and the warm air. It
We
really
all
works
do.
for
We
me.
all do.
Yeah.
At
See?
the moment.
See? So mindfulness is really good too. Attaching a thing, a person, a place with relaxation. Soft music. My faith really helps me. So there's a lot of things that you can do. You just have to set your mind to not want to be in a negative place and then start to implement positive activities.
Good tools, Jim.
A perspective that I think is important for your dad is to also go to the medical professionals that he already trusts.
Yes.
To go to the doctor, because a physician can say to him, you know, we've got this issue that we're facing. There's some options for you. That generation
Yes.
will trust the white coats. And if that white coat says, you know, we need to get some help with this, and we can do this, and we're a team for you, then he might, it's not coming from the daughter, it's coming from somebody that he already trusts. And so I would encourage you to get him or find some way to communicate with his physician right now through virtual, to be able to say, these are issues that we're seeing, and we're seeing this effect on his health. And I hope that would open a door for further conversation and healing.
Good advice. Thank you. All right, our next question is, we hear a lot about the risk of domestic violence increasing with the Safer at Home and social distancing initiative. So how much of an actual increase do you see in Nassau County compared to last year? And Cassie, I'll let you answer that.
Absolutely. So I can speak on that. And just since the stay-at-home orders have started, we've helped over 99 survivors, their children, help get safe, get assistance, just even attend our support groups. So we've seen a definite increase. And what we're seeing the most increase of is our hotline calls, because we've recently added an option where you can text our hotline, especially to domestic violence situation. It's not always safe to pick up the phone. Being overheard can often cause retaliation and increase the dangerous aspect that they're facing. So offering that texting option has been immensely helpful. So we're seeing a lot of texts come through asking for help, whether it be for shelter or just in general, how can I get myself out of this situation? So the numbers are definitely there from last year, increasing at a steady rate, and now more than ever as we kind of try to start moving back to that new normal. And the intensity is what we're seeing. A lot of times people think that domestic violence is physical, and it's so much more than that. And you don't have to be a survivor to have been physically abused. The mental abuse and financial abuse and sexual abuse are very real. And so we're seeing a lot of things and situations, then they're calling and saying, I never thought it would get this far. And I never thought that he would lay his hands on me, or that I would be homeless or have no one to turn to. And so the intensity is there, and it's escalating at a very, very significant rate. And so we're really hoping that people feel comfortable reaching out. We're here to help. And the increase in Nassau County specifically, we just hope that people know we're here for you. And we're a very small town here in Nassau County. I think we can all attest to. Every advocate at Micah's Place is held to that confidentiality. We can't tell anyone anything. And in a small town, that is hard to come by. The risk, fear of embarrassment, the guilt, and the shame are very real things that keep people in these situations. And while they definitely feel them, they shouldn't have to feel them. So we're seeing a steady increase in our requests for our services, especially on our hotline, just to have someone to talk to.
And so let's put out that number. The text hotline is, what is the number you can text?
So you can text or call our 24/7 hotline at 904-225-9979.
Okay. And even if you're not in Nassau County, maybe you're watching from Duval County, the Hubbard House is in
Absolutely.
Duval County. There's other resources in our community.
Absolutely, and they can reference back to, in Duval County, they can call the Hubbard House. St. Johns County has Betty Griffin Center. Clay County has the Quigley House. And Baker County is also serviced by Duval Center Hubbard House. So every county is represented with a domestic violence center that's there to help you. And they all have 24-hour hotlines available to them.
Jim, were you going to say something?
No.
Okay. Okay, let me ask
That's
you.
her expertise.
Let me ask you one more, Cassie.
Sure.
What alternative identification and outreach measures are helping victims of domestic violence the most right now, especially since face-to-face outreach is still limited at this point?
Absolutely. So we've recently, in the last week or two, moved back towards face-to-face appointments if necessary, but we offer all sorts of virtual meetings. And even if you don't have access to that virtual aspect to be able to get on a smartphone, and half of Nassau County is very rural, right? And so they may not have that internet connection. We're simply able to have a phone call to get those outreach services. And when we're able to get back face-to-face, we're happy to do that. But they're still able to call our outreach services. We're here no matter if it's just you're able to talk on the phone to us and we can set up a way to get you help. We're very creative in the ways that we can get to you, whether it's, we'll provide you a mask to come see us. We'll wear a mask, whatever makes you most comfortable. Those services are available to you.
Okay, I want to get to some more questions. And one of the things that we're hearing so much about right now is racism and police brutality. And we've seen the images of the protesters on the streets, and that can spark a whole range of emotions. This question here, what strategies would you recommend for making change in our communities regarding racism? Who would like to answer that?
Well, I would like to answer
All
that.
right.
We'll look at Katrina.
Katrina.
And the reason why I want to answer that is because I've been involved with a couple of groups who've actually kind of already started doing that before the death of George Floyd. So there is this curriculum. I don't know if I want to call it a curriculum, but it is, oh gosh, I cannot believe I can't think of this right now. This is so interesting that I can't think of this because I went over it before I left.
It'll come to you.
Yes, it'll come to me. So there's an organization, the Baha'i Faith Organization, Pastor Daniels, who is the pastor of AME Episcopal Church, and then also Jeanette Richo, who is the pastor of the Greater Fernandina Beach Church of God. They spearheaded, and Dr. Tom Washburn, who is a local activist, they spearheaded an initiative probably last year, it may have been about a year and a half ago, to start to address this issue in Nassau County. For some reason, cracking the code. It is developed by the World Trust Organization for Social Justice and Equity Movement Building. Okay. So it's a film, a documentary sort of. It's done in 3 segments. And what you do is you get a group of community members together and you view the film one part at a time, and then you have a discussion after the viewing of the film. And it was quite interesting, the results of that. The only thing that I would say that would be really appropriate right now, previously when we did it, it was the group was comprised of a lot of local people, a lot of local African American people, but it was interesting because most of the white people were not from here. So I think now, though, that if we would do this again, we need to be comprised of people, all types of people, people that are from here, that are not, all ethnic backgrounds. Of course, we would want to also involve some individuals from the police department as well as the sheriff department, and have this discussion would be a great way to have the discussion. So I think that would be a great initiative to restart in Nassau County, because we've done it before and it yielded a lot of great discussion. So I think that would be a great way.
And I think that's something we can all agree with, is just talking, just communicating, having a discussion, asking people their thoughts and their views will help break down barriers. And that leads us into the next question. How do you,
can I jump in?
Absolutely, go right ahead.
Though, please. As a pastor for all those years, I really understand that the 11 o'clock hour on Sunday is the most segregated time in our community. And so there's a spiritual dimension to this, that for pastors, white pastors and black pastors and congregations, to begin that dialogue, to say we already have some things in common,
right?
Music and scriptures and faith and those things. Why cannot we get and find what else we have in common,
right?
And see each other and break down those barriers within an institution that says we are here to love one another and to help one another. So I'm hoping that initiative will grow even more. But and Anthony Daniels has done a remarkable job in helping that. I hope more pastors will as well. So
it's a great point. We have a lot more similarities than we do differences, and we just have to work to find those. And that leads us into our next question. How do you talk about racism with your neighbors without burning a bridge? Because it's, it's kind of like politics. It can be very sensitive. How do you do that? How do you have that conversation? Cassie?
Absolutely. I think the biggest thing that people need to remember is it's okay to feel uncomfortable
Mhm.
and to be comfortable with feeling uncomfortable.
Yeah.
We're not going to get anywhere unless we have these difficult conversations. And it's okay to acknowledge that they're difficult, or we're never going to get past that awkward phase. But to remember that you don't have to be Black to recognize injustice. It's a human issue, right? So to talk to your neighbors in a way that says, you know, this isn't just to absorb other people's perspective doesn't mean you have to agree, right? We all have our lived experiences. My experience is different for everyone else at this table, and they form my perspective, but it doesn't make them right or wrong. But to hear out just true empathy, to think about someone else's situation and being in their shoes alone can kind of break down that barrier, and to realize we have to work together to move forward. And we don't have to agree on everything, but we do need to see everybody as people. Right. And I won't know how it feels to be a Black woman, but I can sure listen, right? And I can try to absorb that and try to make sure that I educate myself, right? And understanding that it's your job. There's Google, there's all sorts of things for you to educate why people might be upset, why people might be angry, but to look at it as this is a human issue. And it takes all of us to kind of have those difficult conversations and just to be empathetic and try to hear someone out. A lot of times when you go into politics or this type of issue, we're automatically on the defense, on the rebuttal, and just giving someone an opportunity to talk and listen to what they say is really, really important. And just practice active listening.
Anybody else want to add to that?
I agree with Cassie when she said that two people don't have to actually agree on a thing to walk together, but you do have to give each other respect and be willing to listen to individuals. And the other thing that I want to say too is to not expect that your African American friend can make you feel better. You know, it's not my job to make you feel better, you know, and also be respectful of that, the fact that we're experiencing a lot of grief and trauma right now, and that give us a minute. You know, we may not always be ready to talk when you're ready to talk. Just because you're becoming woke right now doesn't mean that I'm ready to talk to you about that. So, you know, give your friend, your neighbor, or your whoever, a person of color that is your friend, give them a minute to just kind of process and reflect about how they're feeling right now. And don't expect for them to educate you. You know, it's your responsibility to educate yourself. You know, it really, really is. And be willing to listen and be empathetic and just be human. You know, this is a human thing. It just happens to be focused on one race right now, and rightly so. Yeah.
Agree 100%.
Yeah.
Okay, how do you recharge, relax with everything that is going on? Because my goodness, I mean, I at the beginning said all that's going on. If you could have 10 years ago said in 2020, this is going to happen, and then this, and then this, and it's, oh my goodness, almost the start, or it is already, we're in hurricane season. Fingers crossed we don't have any hurricanes come. But it just seems like it's just compounding one thing after another, and the emotional stress of one of these events, let alone all of them, it's a lot for anyone. So how do you recharge? How do you relax? Jim?
Well, I think we are so fortunate that we live in a place that all we have to do is roll down the window and maybe drive 2 miles to be reminded how vast and how beautiful and how fantastic our world is right here. So I think even if you have to take a 2-minute retreat and look online at the beach at a webcam or to go outside or to let your puppy dog crawl in your lap, but to realize that we have to pull back from the trauma, to use music, to use your spiritual resources. If you have a church that you can go sit in, the congregation might not be in there, but that might be a safe, sacred place for you. Stop by there and sit and pray and find some ways to allow more than the crisis to be your experience. Mindfulness, like you were talking about. I think for me, I sit out in my garden and look at the birds and realize that they don't really care what my stress is. Their stress is put bird feed in the feeder and let them sing for me. And that brings me, I think it's the song of God for my heart. And that's how I de-stress with that.
So piggyback on that, I think the first thing to remember is it's going to be different for each person. How I find solace and how I de-stress is going to be very different, and how Jim does that. So not everything works for everybody the same way.
Absolutely.
So you really need to figure out what is that secret sauce for you as an individual.
That's a great right.
And we have a lot of introverts and we have a lot of extroverts, and depending on where you get your energy from is going to help you to determine how you're going to relax and find that solace. And there are many things that will work at a level for different people. For example, exercise. You hear exercise and nutrition over and over again as ways to keep yourself healthy. So an exercise for one person may be meditation and yoga, whereas for another person it may be going out and running that marathon and running that mile. Two very different types of exercise. Eating healthy, eating right is very, very important.
Absolutely.
To keep your body healthy. And the meditation. And even listen to music. Some people might want to listen to jazz. Other people might want to have rock and roll blaring, depending on where you get your energy from. So as an individual, you really need to determine what works for you, what has worked for you in the past. And it is stepping away from all of the media, stepping away from the source of the stress, having time when you don't have that, all of that bombarding you, all of that negativity coming into your life, and taking that time and taking that mini vacation, and going to your happy place and spending some time there for yourself, and connecting with other individuals is also extremely important.
Right.
That getting that support from other individuals, and if we can't be with people right now, one-on-one in close contact, we can still do it through the phone or through some other media platform, but getting that support from other individuals.
I think that's so important, just to check on your neighbors, check on your friends, the elderly, your grandparents, because it's that human contact.
Absolutely.
Isolation is not good for us.
No.
Absolutely.
And so just checking and letting someone know that you're thinking about them and asking the question.
Right.
I asked a friend this weekend, how are you doing? And I instantly could see she was not doing well. And then she opened up and shared her struggles. And I think just connecting and letting, if you're struggling, that someone's there to listen, somebody's there to help is very important. This is a great question. Someone that said, I don't recognize the world right now. It seems like there's so much pain. There's not enough compassion. It makes me feel like I've lost what I know. Am I losing everything? Cassie?
It can feel like that, right? We have a lot of things going on at once, and we're all going to experience them in different ways. Kind of like Laureen said, we're all going to have different ways to cope with those. And you're not losing everything right now. Everything's changing, and that it's okay to feel uncomfortable in the change and a little bit disoriented, right?
Yeah.
And it's not going to look like going to the grocery store looks very different right now. Or, you might not be able to attend your church service, and that's your rock. But it's going to come back together. And like we've all just said, it's just maintaining that contact with, the people who understand you, people who are going to hear you, and people who are going to empathize with you and be able to help you get out of that hole. I encourage everybody to go outside, breathe the fresh air, but also remember that you can't control everything, right? A lot of what's happening, we look at COVID, we didn't ask for this, right? And so we can't control what's going to happen next, but you can control what you're going to do. And if you have a good day, and your mentality, what you eat, what you consume, whether it's social media or the news, and taking a break from those things. And so remember, focus on what's in your locus of control, because you can't change everybody's mind. You can't fix everything, but you can definitely control what happens to your future, right? And invest in yourself, educate yourself, do something new, right? That makes you feel good, that makes you feel strong, and makes you feel kind of in control in that moment when things are kind of falling all apart around us, right?
I love that. We cannot control everything, right? And especially now, for those of us who like to control, it's like, oh, what's going on? But we can control how we respond.
Right.
And so that's so important.
Yeah.
And as human beings, we do not like change.
I was just going to say that. I was just going to say the same thing.
We do not like change, whether it's positive change or negative change. We do not like change, but change happens. If something doesn't change, it's actually dead.
Right.
Change happens, and we have to be able to change with that change. And as Cassie said, you need to be able to figure out in your area, in yourself, what you can do with this change. How are you going to let this change impact you, whether it's going to be a negative impact or a positive impact. You have control over that aspect. Of course, there's some things that's outward that, impacts our negative and positive, but even you can look at that in a positive way. So it's all up to you and how you accept these changes that are happening, because change is going to happen. That's life.
And I
Yeah.
think too, for me, like I think about how can I be the change?
Yes.
How can I as an
Absolutely.
individual
Absolutely.
help realize the changes that I want to see made? And
Yeah.
so we each have that responsibility and that privilege of being the best we can be and to spread love and to encourage each
Yeah.
other and to give each other hope. I want to ask you about the role of social media, because we live not only in a 24-hour news cycle, but social media is everywhere. And boy, can it get heated, it can get divisive. You can see lots of positive images, but just as many, if not more, negative images. So how do we regulate social media as we go through the protests and the pandemic and the current world situation when it's right there? And how easy is it to get on Facebook and then you realize I've been on Facebook for an hour. I wasted an hour of my time just looking at other people's comments. How do we handle social media, especially right now?
Just a simple thing. For one, I'm a different generation. It's just wonderful right here. I have repented of my complaining about people being on the phone all the time because I'm on the phone all the time. But I think whenever I would go to the days we could go to a restaurant, remember, I didn't eat the same thing every time I went. If you're on social media, don't have the same diet. Look broader. Look at places and in ways that are maybe would challenge you, but also that would stretch your understanding. Don't eat the same stuff all the time on social media. Increase your diet, learn, and grow because of it.
With that same analogy, everything in moderation, right? You don't overindulge in this big plate of food, and
maybe
right? Isn't that what they say for nutrition? Is eat moderate amounts of different things.
Right.
So that same analogy is moderate amounts of different things. So I agree with there. Social media has been great, and it's also been a terrible invention that's come into our lives. It's both. What we've seen over the past several years are people willing to say things in social media, very negative things to other people they don't even know, putting that out there where they would never do that if they were face to face with somebody.
Never.
Ever. So it has become an avenue for vitriol, for negative, for increasing anxiety and depression, for spewing all this, poison, everything that's out there. And so you get that. Unfortunately, that's what happens. And there's also a lot of positive things with that too. You have that connectedness with people you didn't have before. You're able to reach out. You're able to hear other views from other people and really kind of expand your education horizon. So again, it's up to you. We've been saying how you control yourself, what you say, what you do, what social media sites that you're on. Moderation, don't have the same diet. I like that analogy. That's great. And again, step away. If you have to set a timer on your watch when you get on Facebook because you tend to stay on it all day long, set a timer. Know that, okay, I have to step off and do something that is not digitally related for that hour that I was just, on a digital platform.
And I recommend, if you have an iPhone, turning on that setting that tells you how long you spend on your phone each week.
Screen time.
I am shocked. Screen time. It is amazing how much time I spend on this little device. So I need to take your advice, put my phone down and just have the human interaction. Another topic I wanted to touch on is suicide. Sadly, someone here in Nassau County just recently took their own life. And so we're seeing with the uncertainty and what we've been going through as a country right now, some people turning to suicide. And it just breaks my heart for anyone to feel like they're that depressed and to get to that point. And so I know we all want everyone to know that help is available, but kind of talk about warning signs, red flags for loved ones, for family, for friends, so that we can see these warning signs. And then for the person who's struggling, who feels hopeless, what can we share with them to encourage them and to get them help?
Do you want me to start or do you want to start?
Yeah, you go ahead and start.
Okay. So topic very near and dear to my heart. Suicide prevention is something for Starting Point Behavioral Health Care that we're really focusing on and working on because it is preventable. It's very preventable. And there's not always warning signs. So I think that's important to understand. There are warning signs and sometimes they're not. Some of the standard ones, people start giving things away that are very important to them. They're preparing to leave this world, this place. When someone has made the decision that they're going to complete suicide, and that's what we call it now. It's completion, not committing, completing. It's almost like this peace comes over them, and where someone may have felt this depression and you saw them and now they're out of that and you think that they're better, that's the piece that they've made, that they're going to go ahead and they have a plan and they feel good about that. So it can be deceiving in some aspects with that. People don't really think about it. And you also see the other side too, where you can see someone spiraling out of control, that they've lost everything, that they are in complete despair, they are unconsolable, and if there's substance use involved, they're more likely to complete the act because the alcohol or drugs gives them that liquid courage, as we call that, to complete the act. So pay attention to people's mental health, their mental wellness, the range of emotions that they're going through, and if they are pulling away and giving things away. There's a national suicide text line. Cassie mentioned texting. Sometimes it's easier to text. 741-741. So if you look at your phone, it's the 3 digits going up, 741-741 on your phone. That is the National Suicide Text Line. You can reach out 24 hours a day, 7 days a week to talk to somebody. And speaking to somebody can make all the difference in the world. You feel hopeless. You feel helpless, that nobody cares about you. Life would be better if you weren't here. Your friends and family would be better if you weren't here. You are a burden on them. These are some of the things that people feel, and they don't have that connection. Human connection is so critical for us as human beings. We are social creatures. If we don't have that connection, we don't see purpose in our lives, and nobody really cares about us. So I'm going to say, reach out to a crisis line. Tell somebody. I don't care who it is. If you feel this way, tell somebody, and don't be afraid to ask. Just because you ask someone doesn't mean they're going to complete. Don't be afraid to ask someone if they're feeling like harming themselves, if they feel like they just want to go to sleep and not wake up, or if they feel like this world would be better without them. Ask those questions.
And to piggyback off of Laureen, all of the things that she said are signs and symptoms. But the one thing that I want people to know is that if you identify or you notice someone that may be acting as if they're hopeless, or they're saying that they're, I don't think I should live, there's no reason for me to live, or they've been depressed or hopeless for a significant amount of time, and then their behavior changes to where they're happy. And as Laureen said, that's the person who's made up their mind that they're going to take their life. Ask them how they're feeling, what's going on, because 9 times out of 10, they're wanting someone to ask them what's going on. So that lets them know that somebody does care about me. This is one of my passion areas too, especially among teenagers. And it piggybacks on your previous question about social media. Teenagers are on that so much, and they play this comparison game, and I always call it the avatar. Everybody presents their avatar on social media, what they want their life to be like. And for teenagers, they want their life to be like that too, and they may not see it that way. So I think it's suicide is the second leading cause for teenagers ages 4, or I should say young people ages 15 to 24. The second leading cause. The third leading cause for adults. And the interesting thing is the other 9 leading causes of death in the United States are going down, but suicide is increasing. That says a lot about our country, that the rate of suicide is increasing. And I was at a training not too long ago where this physician who is studying suicide, where he talked about, I think it was like 47,500 something people ended their life. I think it was 2018. And he stated that 54% of those individuals did not have a mental health diagnosis. So we always think it's the person who has a diagnosis who's going to be suicidal. That's not true. So we need to be looking, especially during this time right now, 1/3 of individuals are showing signs and symptoms of clinical depression and anxiety in the United States as a result of COVID. That's not individuals who have diagnosis. That's 1/3 of Americans. So we should be asking that question of anyone that we see that is not responsive, that is not happy, that is showing signs of depression, asking them how they feel, because we don't know whether they're thinking about taking their lives. And it could just be a matter of saying, how are you today? Or how are you feeling today? I'm concerned about you. Just saying, I'm concerned about you could help someone or stop someone from ending their life. So this is something that we really need to be paying attention to right now during COVID, because we're experiencing a level of stress, anxiety, depression that we've never were experiencing
Right,
before.
right.
And they were so shut off and isolated from people that we normally would be exposed to, that, you know, everybody has this feeling of I'm alone,
Mhm.
which is one of the major signs and symptoms of suicide.
In Nassau County, if I'm correct, we have seen a real uptake of
Yeah.
elderly people committing suicide. People that in their 70s, 80s who feel hopeless, disconnected.
Mhm.
We're not made to deal with crisis alone.
No.
Yeah.
We get through
Mhm.
crisis with green bean casserole and our family coming together.
Mhm.
We get through grief when we have people
Mhm.
around us, and that's been removed.
Yeah.
And the tools for coping with these things are not there. And don't be afraid to ask your aging friends or your elderly parents or grandparents if you're seeing signs of depression, to lean in. It's not
Mhm.
just that they're
Mhm.
old, there are real issues that they're facing, and they need somebody to help them ask the right questions.
Yeah, and simply just reaching out, like they said, letting them know that you care,
Yeah.
you're concerned, and asking them how they're doing,
Right.
that could make the difference and save their life.
Yeah.
We've developed a practice at home that if somebody comes to our mind, we call them.
I
If
like
somebody crosses your mind, you call them.
Mhm.
And that just helps, because there's a reason we can stay that connected right now and not say, operator, I'm calling collect to talk to.
Yeah.
I just told you how old I am. That's okay.
You know, for a lot of people, when they're experiencing pain, they turn to alcohol or they
Mhm.
turn to drugs. And so I know we're seeing a lot of substance abuse right now. And I have a dear friend here in Nassau County who lost her son just a few weeks ago, who
Mhm.
had an accidental overdose. He had been clean. He was had fought addiction for many years, but he'd been clean, and then the pandemic hit, and he lost his job, and he was
Mhm.
isolated.
Mhm.
And sadly, he had an accidental overdose. So when it comes to substance abuse, what do we need to know here? When is it becoming a problem? Because I know it's easy to just start having a casual cocktail here and there, and then it quickly can add up, or turning to drugs. What are some of the warning signs, and for loved ones and for individuals as well?
Well, Heather, thank you for bringing up that topic. Again, that has been a concern of mine during the pandemic. At Starting Point, we have seen many people relapse, and a relapse is when someone has been clean and sober and they go back to using again. Unfortunately, it's been with many people who have an opioid use disorder and an alcohol use disorder, and it goes back to what we're talking about with mental health. Also, it's mental health and substance use, or within their behavioral health disorders. Hopelessness, helplessness. They've lost their job. They don't have that human connection, and they need to find a way to cope.
Cope.
So how have they always coped? How has an addict always coped? With their drug of choice. That's their coping mechanism. So you go back to what you know best and what has worked for you. It's almost like an instinct that you just automatically go back there, and they start using, and they may not even have been any thought about it ahead of time. It's just, that's what I'm going to do because I know I'm going to feel better by using. And then you do have accidental overdoses. And once you start again, you pick up right where you left off and you continue using. That's how addiction works.
Yeah.
So that's that one side of people who have a history of addiction. But we also see people, and I've seen it, even newscasters talking about, well, you know, I'm having that glass of wine and I realized I'm having it before 5 o'clock, you know, midday. And boy, I feel a little bit better because guess what? It works. It's an anti-anxiety medication and the alcohol works. And so it's recognizing for yourself, are you doing something different than you had done before? Has your drinking pattern changed than how it was pre-COVID? Are you increasing the amount than before? Are you using it to cope? So for adults who, again, didn't have an issue before and they start looking at that, just recognize what you're doing differently, and is alcohol playing a part in there? And of course, always asking, is it causing any problems? Has anyone said to you, I'm concerned about your drinking? Are you getting behind the wheel of a car and driving after you've been drinking? I've seen a lot of arrests recently in Nassau County because I actually get the in-out report from the jail every morning. This is interesting. And I see what people have been arrested for: substance use, possession of drugs, and DUIs.
Wow.
I've seen an increase dramatic increase in charges for DUIs and drug possession in this county.
Very interesting.
Yeah, it's very interesting.
You know, another emotion that I know a lot of people are feeling right now with everything that's going on is anger. You know, people are just angry. How do we work out that anger in a productive way?
I think the biggest thing is to just identify that anger is not bad. It's how you act or how you respond when you're angry that can lead you one way or another. So it's okay to feel angry. You have a right to feel angry, right? Some of us might be angry we're stuck at home, angry watching the things on television, angry what happened to George Floyd, right? And you have a right to feel those things. So like Katrina kind of said earlier, is validate those emotions, right? But don't be irrational, right? You can feel anger and have a rational conversation, but identifying that it's okay to feel angry, but it's how I act, right? And the emotion in itself is not bad. It's okay. And a lot of times anger is what pushes us to make change, make social change, make progress, right? So if you're feeling angry, you're not alone. Know that much, but know that there's ways to get that anger out. Laureen mentioned earlier exercising, and exercise looks very different for different people, right? But to let off the steam, right? And the steam could be stretching, yoga. It could be just going for a walk outside, listening to music, just moving your body, right? Changing your mood and removing yourself from maybe the source of the anger, whether it's watching TV, and letting yourself have some time to process through that. But surrounding yourself with people who care, identify with you, and want to listen to what you have to say and can kind of help you work through those feelings.
Yeah, and talking about whatever's making you angry, discussing it openly and honestly with a loved one or someone who you know will listen, instead of letting it get pent up and bottled up. As far as the death of the murder of George Floyd, I think that anger is being fueled by historical trauma. And I don't think a lot of people recognize that, you know, there's historical trauma behind the reactions of African-American people in this country. And it was so interesting because historical trauma means there's a history, right? But when you have that history and you still see the things happening currently, that exasperates it. So I was watching, I think, a report, because First Coast News is my news. I have to say that. It is. I was watching a report of the peaceful protests, which then turned into riots, and there was this young man who was beating up a police car, and it was just the back of him, but I was like, it was so much rage in him. I was like, oh my God, this young man is really, really angry, and it just astounded me how angry this young man was. But then I could kind of understand as well. So I think it's a matter of taking that anger and processing it in a positive way, as Cassie said. But a lot of people don't have that option, or they don't have that avenue, or they don't think they have that option or avenue, because there's always someone to help you talk through things and process issues, and even professionals out there to help you process anger. Yeah.
We just got a good question in. With all of us being at home a lot more, we are closer to our neighbors than we ever have been. So what should we do if we suspect abuse of a spouse or a child is occurring? Because I know when it comes to child abuse, a lot of times, or even spousal abuse, parents had that outlet when they went to school. There was a school counselor they could talk to. There were other people. Right. But when people are isolated and they're not connecting, what do we do if we suspect that someone is being abused?
So I'll speak on that.
Yeah.
Right now, children especially are away from the reporting factors, right? A lot of times child abuse is reported at school, through sports, through other people noticing, right? And a lot of times now people are home more often. As far as abuse goes, there's a lot of times it's hidden within the home, and people, what happens at home stays at home. But if you're suspecting something's happening, you have to remember that it's an unsafe situation for you and the person that's in the situation. So you have to kind of evaluate what's going on there, right? Our hotline at Micah's Place is available 24 hours a day to even a friend, right, that doesn't know what to say, and you can explain the situation, right? Have you talked to this neighbor before? I don't know that I would recommend anybody to go up to a stranger that you've never talked to and say, I think you might be being abused. That's not going to get anybody anywhere, right? So making sure that it's a safe place to approach them, even if you're out walking, hey, how you doing? You don't have to acknowledge what you heard or what you saw, just checking in and then kind of creating that rapport to let them know that I'm a safe person. I'm here to help you. And knowing that, especially right now, calling the police and what we're looking at in the world may not be the answer for that person, right? And a lot of times there is retaliation. So I think making sure that you look at the entire situation and what the person's going through before you react. And a lot of times if you come at them and you want to help their situation, you want to fix it, and that's well intended, but they may not be ready to leave that situation, or they may have not recognized it like that. But starting to have that relationship, and if it's someone you know well, just like when we talk about substance use, it's I care about you, I'm worried for you. You know, this is a safe place. I called Micah's place and they told me these things are available to you, and they're not going to say anything to anyone, and this is how I know you can get safe. So it's really based on how much you know about the person that you're trying to help, right? I would not, you have to make sure it's safe for yourself and that you feel comfortable. We've seen a lot of things on social media lately of reaches out to people who are in abusive relationships, message me and ask to order this, or put your hand up during a Skype call, and that'll signal that you're in distress. And I would encourage those people who are offering that are awesome, right? But to make sure they know what that next step is going to be, that next step of who am I going to call? Who am I going to refer them to? And you know that you can't fix the problem alone. There's legal protections out there for those who are being abused that keeps them away from their abuser, that can keep them safe. We offer that free legal assistance. And we know that housing and financial stress is very real, and that's something we help with. It can seem awfully daunting to leave a situation. So to come at someone with solutions, things that are out there that can help them, but knowing the person before you go is very important, and making sure that it's a safe option for you to say something. So if it's a neighbor you don't know, I would recommend just hang out outside, go for a walk, say hey, and work that relationship up before just, kind of saying, hey, I saw this happening. It's going to make them feel embarrassed and ashamed, and you don't want them to retreat any further. So if you're experiencing that or seeing that, I encourage you to call our hotline and kind of work through it with our hotline advocates of what's going on, and see how we can help. We're there, and every situation of abuse is very different. And with children especially, you're a mandated reporter. And so when it comes to kids, they can't always pick up the phone and call us, right? So I would encourage you to contact, someone to keep that child safe. Whether it's law enforcement, the grandparents, depending on how much you know about that situation.
Great advice. Just don't look the other way.
Absolutely.
Yeah. This is a great question. I think a lot of people can relate to this one. How do I find balance between working at home and my family needs without getting too stressed out? I have 2 young kids. I'm working from home. I think anybody.
Heather, you want to answer that question?
I'd love to hear your advice. Who wants to touch on that one? That's a good question.
What I've done is,
We all have it.
and my situation is probably a little unique because I was working at home before the pandemic. So I had to learn how to get off work. Stop working when your 8 hours or 9 hours or sometimes 10 hours come. Discontinue, disconnect, turn off your cell phone or put it in another room, put your laptop down and stop actually working. I just can't imagine. So you may need to take it from here, Heather, because my children are all adults and they live somewhere else.
Yeah.
So I couldn't imagine how to navigate work with small children in the home.
Yeah, it's been challenging, and I think I just have to sometimes step back and realize this is a blessing that I get this time to be at home with my kids and try not to stress out, just to put it into perspective. Yeah. And I think finding that balance, at first I was working, because I work usually in the evenings, I was getting up in the morning and working all day and then working all night. And I never got a break. The computer was always there, the cell phone was always there, but I think I found a way kind of just to make my time the most effective and still set aside time for my kids, still have that dinner with them and that human interaction with our children. But it is definitely a new norm, as everyone's saying. So it takes some getting used to.
I encourage, as someone with a small child at home as well, I look at it as a blessing because we're never going to have this time at home with them, especially as working parents. But my biggest advice is if you're working at home, please get up, right? Get up from your desk, walk away, eat your lunch away from your desk, away from your computer, and take a second to yourself. Walk outside, right? Depending on your work setup, if you have kids at home, talk with your supervisors and with your bosses of how can I get this work done and make sure that my family needs are met, and express that, because I'm sure a lot of them would be willing to work with you. But look at it as a positive, right? We, as working parents, both of us can agree that we don't always have this time at home. And so I look at it as a chance to have more movie nights and more karaoke parties and more time to do arts and crafts and run around outside with my daughter, because that's what's important right now. And so it's taking that positive outlook on something that can seem a little bit overwhelming, and knowing that you gotta clock out, right?
Yeah.
You gotta clock out
You gotta
sometimes.
clock out.
And I think that's crucial.
Yeah.
Behind my house, they've put in this river to the sea bike trail on Amelia Island, which is wonderful. It's right behind my house, so we can enjoy that. But it has been a delight to be on my porch and to see people, whole families, riding kids on tricycles and parents with. It's just been amazing, the energy and the family moment that I observe, people being creative in those moments, because there's a place. Get outside. Try to have those things that you treasure, that those memories you'll never get again.
Yeah, we've started taking family bike rides on the weekends, and it's just been so special. And so many people, I saw a Facebook post talking about what the pandemic is like from the vantage point of children, and how many of them are looking at it as, I get mom and dad all the time.
Yeah.
We get to play games. We get to have good old quality fun. And so hopefully we can focus on that positive. But someone asked this: what are some tips for monitoring the mental health in our children and resources that are available? Because while they're getting a lot more time in most cases with mom and dad, just all that's going on can be stressful for kids. I'm trying to understand why they have to wear masks when they go out, seeing the images of the protests. And so how can we monitor their mental health, and what resources are available?
So we've said several times today, ask the question, have the conversation. And it all goes back to communication, right? For everything in our lives. So you need to talk to your children, and if you believe they're feeling anxiety or stressed out, ask them, or just say, how are you feeling today? How are you doing today? I have a 19-year-old, and she was saying, it was very stressful for her to finish her college, her second year of college remotely, and so we talked a little bit about that. So you just need to ask the question, say, okay, how are you feeling today? And talk through those emotions and what's causing those emotions. And again, it's the locus of control, the things that are out of their control, and they see these things, and just talking about it can bring a sense of calming and some resolution. So I'm just going to recommend, for every conversation we've had, everything we've said, we just need to open up the conversation.
Absolutely.
And there are different mental health resources. There are many out there for teens. Again, with Starting Point, if it's a mental health crisis, we have a crisis line just for children and adolescents, and that is 904-580-0529, and that's for if your child's in crisis, or you're in crisis for a teenager and you need to call, say, how do I deal with my child in crisis? So that 24/7 number is out there, and we can get some websites and some information out that we can put out on Facebook and put out onto the news, with just specifically for teenagers, and I'll get that information out so we can post that later.
Well, this hour sure has gone by very quickly. And before we close, I'd like to, y'all have been so full of wisdom and great advice. I just want to go down the row and have you each share kind of some practical tips, what people can take away and what they can be doing right now to ensure their mental health is in a good state right now. And so Cassie, just final thoughts as we wrap this up.
I think it goes back to focusing on what you can control and figuring out what gives you that moment of reprieve, that escapism. And it can look a lot different for a lot of different people, but reminding yourself that you don't have to be the super person, and you can take a minute and step back, let yourself process. But also in the same regard, look at it in a positive lens, enjoy it and embrace this time, because it may never happen again. So know that our community, Nassau County, I can speak for all of the people here, we're here to support you, and we want to help you.
Absolutely.
Katrina?
I would say be self-reflective, as Cassie said, be self-reflective. If you see yourself getting anxious or depressed, reach out and talk to someone. If you need to speak to someone professional, do that as well. It's you're helping yourself. The one thing that I did want to say that I didn't say before is that it's a lot of stigma related to reaching out to help, ask for help. And people shouldn't feel ashamed, especially during this time, because right now everyone needs some type of help in some type of way. So don't be ashamed to reach out and get some help for yourself if you need it professionally. And just be self-reflective. Take care of yourself and know yourself when you're getting to your limit, or when you need help, or when you need to step away. And I think that's what keeps us healthy.
I think there's 2 points I'd like to stress. Out of crisis comes opportunity. Seek the opportunity within this situation right now, and be creative. And how can you reframe this and look at the positives and what you can do differently now. The second point is what I call social connectedness, and that's our social support. Again, humans are social creatures, and you need to build that support system. You need to reach out to others, have those conversations, whether they're tough or not, and make sure that you have that human connection and that support for yourself during this time.
I know, and we know, that what happens on the outside affects us inside.
Mm-hmm.
If it stays inside, though, the thoughts and the anger and the anxiety, it doesn't get creative. It doesn't have resolution. We need to look from the inside now to the outside for spiritual resources. I think look at your life and look at the places where you have shown yourself resilience, where you have shown yourself courage, where you have shown yourself the ability to be creative, to solve a problem, to be connected, to feel good about what life is and where you are, both spiritually, emotionally, physically, in all those ways. And to really hear this from all of us and from those around, we are not alone in this journey.
Yeah.
We are in this together. All the media have reminded us of that. Mm-hmm. We are not alone. Somebody knows your name and somebody cares. Let us help you.
Jim, Laureen, Katrina, Cassie, thank you for being here today. I learned a lot, and I hope everyone who's watching takes away something that's going to help them in their lives. And I think more than ever right now, we know and we see how important it is to connect with one another, to love our neighbors, and just be there. Just listen, reach out, and if you're struggling, if you need help, I hope you have seen today that help is available. Have hope. And share this Facebook post with your friends, with your family members, because you never know whose life it's going to touch, whose life it's going to save when they hear that help is available. So thank you so much. I want to thank the Nassau County Emergency Management Office for bringing you amazing panelists here today to share your wisdom and your advice. And just a reminder, all of those resources, the hotlines and the numbers to text, they're all on Nassau County Emergency Management's page, as well as firstcoastnews.com. So we've put them in one easy story for you to click on and get help. But if you need help, go out and ask for it. Thank you so much for joining us.
Heather. Thank you.
Thank you
Take
so
care.
much.
God bless you.
It's been wonderful.